Hi everyone, I Urja Dirwani, the president at SCRMP Pharmacy Wing, Gujarat State Chapter. Welcome all of you to our webinar AI in Healthcare with our expert today, Mr. Manthan Mehta. I also have with me from our team, Nisar Patel, who is our vice president, and Mr. Morzi, who is the national chairperson, Pharmacy Wing Student Forum. Before I start, let me brief you a little about SCRMP. So SCRMP, which stands for the Society of Clinical Research and Medical Professionals, is a registered society based in Telangana, India. And it is dedicated to advancing clinical research and supporting the healthcare professionals. Our mission is to foster innovation, education, and collaboration, and to support medical professionals to have the knowledge and tools accessible to them, which are very necessary to enhance the patient care. We work by organizing workshops, seminars, and initiatives that aim at contributing to the global health and to the life science industry. Our vision is to be a leading organization in advancing the clinical research as well as the practices in the pharmacy profession to improve the patient care and ultimately improve the healthcare outcomes globally. Our mission is to provide education and resources to all the healthcare professionals and the pharmacists to promote ethical and innovative clinical research and pharmacy practices. I would like to introduce you to our speaker, which is Dr. Manthan Mehta today. He is a distinguished healthcare innovator and physician who is currently holding the position of a co-founder and a chief medical officer at ICSA.ai. Sorry for the inconvenience. I think there was a network issue. I hope I'm audible now.
Yes, you're audible. Yeah.
Okay, all right. So about our speaker today, who is Dr. Manthan Mehta, I would like to brief you all about him. So Dr. Manthan Mehta is a distinguished healthcare professional, innovator and physician who is currently holding the position of a co-founder and a chief medical officer at ICSA.ai. He is at the forefront of transforming patient engagement and adherence to the use of AI-driven solutions. He has obtained his MD in pharmacology from Topiwala National Medical College, where he gained expertise in drug evaluation, clinical trials, pharmacokinetics, and healthcare analytics. His research has earned numerous accolades, including the ICMR MD/MS Thesis Award, the Novartis International Biochem Award, and the Dr. M.S. Kegre Best Resident Award. Beyond these achievements, he is also passionate about monitoring the generations of healthcare leaders. He is actively mentoring the emerging talent through platforms like TopMed and Mentorly. His areas of expertise include AI-driven healthcare innovations, novel pharmaceutical strategies, and ethics in clinical research. I hope you all are as excited to level up your knowledge as we are. And I hope you'll all hear to him and you'll be assigned 10 minutes at the end of the meeting to ask any questions or queries that you might have. I will now hand over it to Dr. Manthan Mehta, please.
Thank you so much for your kind introduction, and thank you, SCRMP, for having me here. It's heartwarming to see close to 100 participants on a Saturday morning interested in it. But I guess AI is such a buzzword that everybody wants to know, what's in store with AI and how it's changing the world. It feels like magic to a lot of people, and that's why I think we've got a very good attendance here. So thanks so much. The funnel itself used to take years, right? And today that time has been cut short 2 weeks. And that's the role that drug discovery, AI is playing in drug discovery, which is again the need of the hour, right? One example that I know of people are trying is in AI-driven antibiotic discovery. We know how rampant antibiotic resistance is, right, today, and not enough research goes into developing newer antibiotics or other things, because in acute care, from a business case and a commercial perspective, people don't really invest so much in antibiotics. There is a limitation when it probably comes to the way the traditional method of drug discovery works in terms of identifying and then coming to a lead of an antibiotic. By the time that antibiotic hits the market, you are going to see that, probably the entire microbiome pattern and the bacteriogram of the region has changed. So that can really be cut short with AI, right? We all went through COVID as a disastrous pandemic, and we saw how quickly we all were able to get a vaccine, and development, all of that happened very, very quickly. A lot of role in assisted AI technology was taken there, because today AI has become a buzzword. Everybody is talking about it. But there have been small things that have been happening since many, many years in this space. And again, imagine if that time AI was as rampant as it is today, 4 or 5 years ago, it would have been brilliant, right? To, in case, find the technology, do the screening. Everybody knows whether they are at risk of COVID or not, identifying who others around you, are probably at risk, etc. And things could have been very, very different, right? So that's where a lot of role comes in terms of drug discovery, and huge investments in this space. A lot of big multinational pharma companies are buying out, smaller startups and other companies which are working in the drug discovery space with artificial intelligence, right? So next is personalized medicine. And this is where AI can actually be a game changer, where you imagine that AI tailors your treatments based on genetic profiles and many, many other elements. And this is also something that, we are working at ICSA in terms of personalized treatments, where you are able to actually identify, you are able to create a biopsychosocial profile of an individual. And based on that, you're able to tailor their treatments. Based on that, you're able to predict what kind of information they need, what is their behavior pattern beyond the clinic. Are they following the advice given to them? Are they having any side effects? If they're reporting a side effect, how likely are they to drop off from the given treatment? How likely are they to change the treatment? How likely are they to change the doctor? And all these various parameters are something that we all want to look at. And this is one space where we all believe that this can actually change. When we talk of personalization, and we are all very used to OTT platforms or, online shopping, e-commerce and quick commerce, where if you realize that they show you things that based on your past interactions with the platform, that's what it shows, presuming that, this is what the user will like, right? If you watch 4 reels on something trending in the current state on Instagram, you're going to see your feed is, automatically gets changed into that, right? And then one fine day you are probably not feeling very happy, and you are looking at all motivational reels. The next few days it's going to keep showing you those. So the algorithm changes, but that happens when you are, consuming content on these micro platforms or social media, or when you're consuming content on OTT like Netflix, Prime, Hotstar, etc., where again it shows you, gives you suggestions based on what it feels your likes are, based on what you've been watching over days. So, but healthcare lags there, right? You don't have that facility in healthcare today where you actually need it the most, saying, I have this as my genetic profile, this is my social profile. Like, it gives you advice like, walk, exercise every day. In today's busy lifestyle, a lot of people don't have time. It tells you should eat every 2 hours probably, but you are at work, you are probably in college for 8 or 9 hours of the day. How are you going to eat for every 2 hours? So that level of personalization has not come into healthcare, and that really will evolve because that kind of technology was not available, right? You did not have artificial intelligence that could do that, and that is how it's going to change the future. In surgery, right? In robotics, we've seen that, and the Da Vinci surgical system has been around for a while now for minimally invasive procedures and robotic surgery. But if you have more AI power in these robotic systems, it can enhance your precision. And how will that help? With an enhanced precision, you have reduced chances of complications. So anyone who understands surgery or has had undergone one or has had a near one undergo surgery, the surgery goes well, but what happens in the OT, and if you've ever been inside the operation theater, you realize that there are a lot of things that happen, right? When the incision happens, there is stretching of the tissues. Sometimes you're not able to get through the region. You do an extra cut, you angulate it, you stretch further, you put in instruments, you do all of that. And all of that, increases later the risk of complications in some way. And the recovery time is delayed, right? There is pain, at that point they're in anesthesia, but the moment they are out of it, you realize there is a lot of pain that comes in, and that stays for a longer time depending on how much has gone through during the surgical procedure. And that's where, precision can really help. So it's not like AI is going to do operations and, they're not going to be surgeons anymore, but it's the level of precision that can do. So we went to one step further, created robotic systems which are very precise, that if you can go even beyond, and then put in that AI which can actually pinpoint and show you this is where probably say a tumor is, or this is where that nerve is, this is where this is, and you're really careful that don't touch this here and don't touch that there. And that's what's going to probably, change all those features and elements, right? So that's where it will enhance another bit of it. When we look at the healthcare setting, right, hospitals, if you see, particularly chaotic places, right? I think most of you have had postings in a hospital or have visited a hospital at some point in their life, and if you realize it's absolute chaos, right? I think few places where I see complete chaos is, I think hospitals are one. Two is like airports, railway stations, where there are a lot of people, a lot of operational hustle, administrative burden, right? We all know of memes which go around saying, you have to fill a paper first to get admission in the hospital, or for a doctor to come and see, or for any treatment to start. Tons of paperwork, right? One caregiver is busy all the time in any hospital just doing paperwork, figuring it out, right? If you're in a government setting, you have different set of paperwork. If you are insurance covered in private corporate hospitals, you have another set of challenges with paperwork. So extreme administrative burden for the patients, extreme administrative burden for the people working there, right? All the staff in the hospital is always, hassled with so much of paperwork, so many of entries, maintaining hundreds of registers and all of that, so much of documentation, hundreds of questions that patients have, thousands of questions that their relatives have, and it's never ending. This is again a place where, you can bring in a lot of automation, a lot of AI, which can help. Automated documentation. Who doesn't need that, right? Today, in India, it's less common, but in the Western world, we see a lot of AI scribes, ambient AI scribes. So like today we are recording this session, right? And similarly, everything that is happening inside the clinic, all the conversations happening are being recorded, right, in real time. And then they are also now being summarized and created a documentation, given one page or and a summary. This is how I want to structure it. These are few topics I want to cover. Please help me with it. And I got an output. And so it's a total of 15 minutes work. That also because I'm very picky about what output it gives, and I ask it to like create new ones and add and delete things. But otherwise, if it's not something which you're putting out in the public domain, probably it's a 5-minute job. So imagine presentations that would take me at least 5 to 10 hours to make happens in 5 minutes.